I want to thank Chris, Anna, and Julie for inviting me to participate in this truly amazing convening. And I just want to say it's been great to reconnect with some friends, but then also meet so many of you whose work I've so long admired and used in my own work on a daily basis. So I'm Maddie Solan. I am a social science analyst for the Department of Health and Human Services. So I'm here today to discuss some of the policy implications of your work and speak to the translational piece of this conference. Please note that any recommendations I give here today are my own views and not necessarily the views of the Department of Health and Human Services. So in the spirit of translating, I wanted to spend just a few minutes giving a general overview of my office and the work that I do there, just to kind of explain my perspective that I bring to this work. And then I want to share 4 key takeaways that I've concluded from the work that you've shared through your presentations, through the conversations we've had, and through the draft chapters. So I am a social science analyst with the Office of the Assistant Secretary for Planning and Evaluation, which we lovingly call ASPE for short. My office is the principal advisor to the Secretary on human services policy, meaning that we do policy coordination, legislation development, strategic planning, policy research, evaluation work, and economic analysis on a number of different human services policies. We focus primarily on early childhood development, reducing chronic and family homelessness, strengthening families, child support enforcement, and place-based initiatives. At ASPE, I lead an interagency working group focused on supporting children of incarcerated parents. So I work very closely with the White House and with many offices in DOJ, the Federal Bureau of Prisons, the National Institute of Corrections, the National Institute of Justice, and we work together to try to coordinate our resources and support policy initiatives that will really, that are driven towards helping families impacted by incarceration. And then I'm also a senior advisor to the Federal Interagency Reentry Council, which hopefully some of you have heard of, but this is an interagency body first convened by Attorney General Holder in 2011. And it's specifically focused on trying to create opportunities for individuals leaving the criminal justice system. So that's the perspective that I bring to your work. And to get into my comments, so the first key reflection I've had over the past few days is that I think that to really help children, we need to better help corrections. I think that Rebecca made a really key point yesterday when she talked about how corrections often chooses interventions without much thought or without much theory behind it, or without much evidence. We also discussed how our correctional system in general is designed to be punitive and not necessarily rehabilitative. And from the correctional perspective, many correctional officers are there to maintain order and keep safety. And so that's why I thought that the Gordon Hunter and Campbell's list of programs for children of incarcerated parents and Danielle Dallaire and Rebecca Schlafer-Neely's careful write-up and analysis of existing programs for incarcerated mothers was such a helpful and long overdue contribution. I know that the Federal Bureau of Prisons has asked me on a number of occasions, what is the evidence base behind parenting programs for incarcerated mothers? And so I'm really excited to be able to pass that work along to them. However, I would say that it was discouraging that so few studies included in that review have examined programming's impact on mothers' disciplinary infractions and recidivism. Because I think that these are the key outcomes that will really be able to convince corrections to help them see the reasoning for why they should invest in and support more parenting programs and things like extended visitation, which we know are kind of slowly being, they're leaving our correctional system across the country. And there was a great article in The Nation about that pretty recently. So being from HHS, I, of course, am very interested in the child outcomes, and I agree that it would be wonderful to have more research showing that these parenting programs make a difference for children's development. And I think that would be great, and potentially we could get more resources from the Department of Health and Human Services or across agencies. But I think that we have enough implementation science to show that you really need the Department of Corrections buy-in in order for the programming offered within prisons to be effective. So I would just make the case that I think we really need to prioritize looking at things like behavioral infractions as an outcome of interest. I'd also just flag that there is reason to believe that some of the funding for parenting programs might get even tighter. I don't know if, I'm sure many of you have heard this, but the Federal Communications Commission is going to implement caps on the cost of phone calls from state and federal prisons as well as jails. So that calls that used to be as much as $15 a minute will now be capped at 13 cents for interstate calls made from state or federal prisons. And though this is bound to have a positive influence on family communications, and I would definitely encourage all of you to potentially look at examining the effect of these caps on family communications and potentially child outcomes, there is a possible downside to this, and that is that prison administrators often talk about using some of the fees that they collect from these phone calls to pay for their parenting programs. So there might be this unintended consequence of seeing less programming offered in prisons. So I would say it's just really, really key that we think about the outcomes that are going to be convincing from the correctional perspective. On translating research into practice, I also want to encourage you to use the work on evidence for programs to help promising models get included on some of the government-managed registries of evidence-based programs. The National Institute of Justice has crimesolutions.gov. The Department of Justice also has the What Works in Reentry Clearinghouse. And the Substance Abuse and Mental Health Administration has the National Registry of Evidence-Based Programs. And these registries are taken very seriously. They're managed by the government, and they do careful reviews of the evidence to make sure that they are of acceptable level of rigor and quality. And if you're included on those registries, you might be more likely to get funding for certain programs. But then they're also where practitioners look to frequently to decide what models they want to use. So if we want corrections to implement models that are based in theory, that have demonstrated results, I think we need to make those models easy for them to find. And I would encourage all of you to think about how you might be able to help facilitate making those connections. So that's my first point. I think to help children, we need to help corrections. My second point is that developing interventions for children of incarcerated parents is extremely difficult. I want to applaud Jennifer Noyes, June Paul, and Lonnie Berger for their thoughtful response to the key question: does it make sense to create interventions like mentoring programs that specifically target children of incarcerated parents, or do we invest more in programs that have a demonstrated evidence base, like the Maternal, Infant, and Early Childhood Home Visiting Program, MICV, place-based initiatives or interventions like Moving to Opportunity to ensure that they reach families impacted by incarceration? And I know this is an unsatisfactory answer, but I fully believe that we need to take both approaches. I think that our broader policy work and our work on anti-poverty programs really has tremendous potential to help children of incarcerated parents. But they need to, but these programs often fail to take into account the larger context of mass incarceration and over-policed communities in their work. So just to talk a little bit about the Moving to Opportunity program, which basically gave families housing assistance and supportive services so that they could move to neighborhoods with less disadvantage. And many of the evaluations actually found that the families really struggled to move to areas where they actually had less where they had less neighborhood disadvantage. The evaluation results found that many of the children were still attending majority-minority schools, schools that had high rates of poverty, and that so they found that the rental assistance and the supportive services might actually not have been enough to help those communities. But I just wanted to say that I think this is actually a really exciting time to be working on reentry policy. I hope that some of you are familiar with the Federal Interagency Reentry Council, but we've recently published a brand new report that documents all of the policy changes, all of the new resources, and much of the work that we've been doing across agencies to support people coming out of prison and jails. There's a whole chapter dedicated to supporting children of incarcerated parents, and I brought a few copies with me, so I hope you'll take a look at it. But just to highlight a few examples, HUD recently issued guidance to landlords indicating that it might actually be a violation of the Fair Housing Act to have blanket bans for anyone with criminal records. Also, the White House launched the Fair Chance Business Pledge, which is a call to action among employers to get them to be more intentional in how they use criminal records in their employment decisions. And thinking about things like when the offense occurred, how much time has elapsed, the nature of the offense and how it relates to the job itself. And this has really caught fire among private industry. American Airlines, the Coca-Cola Company, the Koch brothers, Facebook. They've all signed on to this pledge. They also have a similar one for higher education institutions, asking them to reconsider having that box that might screen out someone who has a record from being considered for getting into that school. The Department of Health and Human Services, to talk a little bit about Rebecca's point about Medicaid. So during National Reentry Week, the first time we've ever done this, which was the last week of April, the Department of Health and Human Services released new guidance on Medicaid coverage about individuals leaving the prison system. And they gave states the option of giving full Medicaid coverage to individuals in halfway houses that are state and locally operated. They also encourage states to suspend rather than terminate Medicaid coverage during their incarceration so that it's easier for people to get access to health care and access to the behavioral health and the substance use and the mental health services they really need when they leave. And then to touch a little bit on child support policy. So I was so glad that you brought up the CSPED demonstration, Lonnie. That was, we're really excited about that work. But I also wanted to mention that there's a new proposed rule from the child support program that would prohibit states from treating incarceration as voluntary unemployment. And 14 states currently do not allow incarcerated parents to apply for modifications to their child support order. And of course, this leads to huge amount of arrears and debt when they're leaving prison. So while all of these efforts are not going to solve all the problems, I just wanted to make the point that I think we have made a lot of progress in the policy world, and there's so much interest and attention right now that this is just a very exciting time to work on this set of issues. So come find me if you want to see the report. I also want to take this opportunity to highlight a brand new data set. Because to respond to Michael's point a little bit about why we might not have made as much progress over the 10 years as we would have liked, I think a key barrier to progress is the lack of data. You know, we rely on these few data sets that we analyze and reanalyze, but we really need more national population surveys to ask questions about incarceration on them. So I want to tell you about this awesome new data set that the Department of Health and Human Services is about to publish in early 2017 on ICPSR. So for the past 10 years, my office has managed the multi-site family study on incarceration, parenting, and partnering, which we call MFSIP. This is a $13 million, 10-year implementation and impact evaluation of 5 program sites that received funding from the Administration for Children and Families to implement activities to support and sustain marriages and families of fathers during and after incarceration. The sites offered a range of different services to incarcerated fathers. And unfortunately, because of all of the limitations imposed by the correctional systems at the facilities, there was a lot of variation in what services these programs provided. But they all provided some sort of parenting classes, relationship education workshops, and some economic stability programming. And the study collected data on couples, including roughly 2,000 eligible incarcerated fathers and roughly 1,500 of their primary intimate or co-parenting partners who are on the outside. They conducted interviews with both the incarcerated father and their partner at baseline, right after the intervention, at 9 months, at 18 months, and at 34-month follow-up periods. And the retention rate, they really focused on retaining the couples in the data collection, and it's over 70%. So they did a great job at tracking these couples after they, and tracking the incarcerated father after he was released. The longitudinal interviews collected information on a host of key factors related to family functioning before, during, and after incarceration, and questions unique to how incarceration shaped and impacted family relationships, including self-reports from the incarcerated father and separately from the caregiver on how incarceration affected the father-child relationship. They also collected information on prevalence of domestic violence among couples before, during, and after incarceration, and how that domestic violence contributed potentially to relationship dissolution. They collected data on expectations for reentry. All of the study participants were asked about all of their biological children as well as non-biological children that they've been a parent to in some way. So this data is able to give us a sense of how complex and complicated these families are in the multi-partner fertility. They also collected more detailed information on one focal child, and this focal child was determined by a child that the couple had in common, and then it was the child that was closest to age 8 when the survey first began. And so they collected information about the father's frequency and type of contact with the focal child, the perceived relationship quality, both the father's report and the caregiver's report, the child's school attendance and grade retention, behavioral problems, foster care system involvement, and whether or not they had a child support order and for how much. The survey also collects detailed information on the length of incarceration, the type of crime, the number of disciplinary infractions that they had since they were incarcerated, the number of transfers, and the number of times they were in administrative segregation. They also collect, and I won't keep going on, but they also collected a lot of information about the services the incarcerated fathers, as well as their caregivers, report that they needed, and also the services that they actually received. So it collects information on parenting program, but also anger management, substance use treatment. And so I fully believe through this data, we can better understand the effects of a father's incarceration on families and how they vary by the quality of relationship prior to incarceration and during incarceration. And we can look at the effect of the nature of the crime and the length of the sentence on children's outcomes. So as you're waiting for the BJS Survey of Inmates data to be released, or the 15-year file of fragile families, which I know everybody's excited about, I just hope that you and your research assistants and your graduate students will consider looking at this data set, because I really think it's going to help answer a lot of the questions that we've identified over the past 2 days. Yeah, so I actually brought a whole bunch of handouts that actually list all of the variables that they collected and at what time points. But yes, I'll say the name just one more time too. It's the Multi-Site Family Study on Incarceration, Parenting, and Partnering. But we always refer to it as MFSIP. And we've published maybe 10 or 11 different briefs already through the study. A lot of it is implementation science and just the challenges of implementing a multi-site intervention in prison. So I think, I wonder whether or not anyone ever comes to the ASPE website and sees it. So I really hope that you'll take a look at the published work. Yes, yes. Just search MFS-IP and it should come up. So the very last point I want to make and is that your work really, really matters from a federal policy perspective. I use all of your research on almost a daily basis, which is why it's so great for me to get to be here and speak with all of you. And then I just wanted to maybe say a few words about how I use your work in my day-to-day life at HHS. So it frequently informs our legislative development. We frequently get requests to provide TA and comments on draft legislation proposed by members of Congress. So just last week, I got a request from a senator who was interested in building off a proposed bill, HR 5130, which would essentially establish a pilot prison nursery program in all federal women's prison facilities. So I was able to pull a lot of the research about the most effective time of previous prison nursery programs and use a lot of your work to kind of help shape the TA that we gave on that. It also informs our training in TA. So when there's no new legislation, which is pretty much all the time now, and when there's no new funding, the federal government often relies on using the bully pulpit to lift up promising practices and provide training to service providers. So we've done a lot of different trainings for teachers and school administrators, pulling very heavily from the work of John Hagan and Holly Foster, as well as Danielle's work on some of teachers' either intended, conscious or unconscious biases. We've also pulled together a lot of training for correctional officials within the federal system. And every single time we do that, we use your research to help inform what we include. And then lastly, and the work I do the most of, maybe perhaps unsuccessfully sometimes, is I use your research to make the case for more resources. As I mentioned, I work pretty closely with the Department of Justice, and then I also do a lot of policy coordination within HHS. And so I just use your work to kind of talk about the effects of parental incarceration on children and why it's worth investing more money in interventions and in research. So just to give an example, I used a lot of Joyce's work and others on the traumatic experience of prison visitation in order to kind of talk the National Institute of Corrections into investing in this $1.2 million study to identify and implement model family strengthening policies that can be implemented in state and local corrections, which I think many of you here are familiar with. I know Hillary is. So it's kind of like a chicken or the egg situation. I mean, I need your research to get more money for additional research. So I just want to thank you all so much for the work that you do. It makes a huge difference. And I realize a lot of my work is just internal memos. And so you don't see the ways in which your research actually matters, but it does. And the one last thing maybe I'll say is please, please, please consider incorporating more cost-benefit analyses into your work. I think cost-benefit analyses, they make such clear cases, and they are seen with a lot of respect on both sides of the aisle, which is, very, very useful for right now. And I really don't think we do enough of it. And I just thought that the piece that was discussed today, it was really, really informative about alternatives to incarceration. But I just kept thinking, could we just push this to do a little bit more cost-benefit analysis? Could we have quantified those reductions in recidivism? Could we have quantified the reduced risk of child welfare system involvement? Because having a child in foster care is extremely expensive, both in cost for the actual program, but then cost for the child. And so I just, it's so much easier for me in my work to convince people to get more resources if I have a clear cost-benefit analysis that says, look, it just makes sense to do this approach over this approach. So please, please keep that in mind. And then, sorry, I lied. I have one other point. And that is, please, because your work matters so much, it's important for you, and I'm dependent on your research and my work. It's really important that you consider the policy implications of your work, not just when you're writing your paper and you get to that section, oh yes, what are my policy implications? Oh, we need criminal justice reform. Okay. I really think that you should try to think about policy implications when you're designing your research questions up front. And really, yeah, I'll just leave it at that. Try to think about it from the beginning and disseminate, disseminate, disseminate. I can't use your work unless I know about it. And I try to stay up to date, but I would encourage everybody to think about some of the different listservs that highlight really promising research. Like there's Reentry Central, the Marshall Project, the Sentencing Project. I mean, I think that those are all places that really, really look to highlight interesting new research in this area. And so many people get those listservs. So I really think that maybe you should consider different avenues for disseminating your work to make sure it gets into the hands of the people who can really do something with it. So thank you very much. Happy to take any questions.
So, Michael, I realize that I'm speaking to the back of your head, so I will move to a different place. I really appreciate. I mean, I can do that too. But I guess, I mean, the one thing I did want to say is I appreciated many components of your talk. I think that, I think that where the research has gone part is true in the sense that there was like a nice sort of theoretical model laid out, and we just added a couple wrinkles to that in the last maybe 15 years. But in terms of the rigor of the empirical analyses, I mean, the stuff that gets reviewed in that chapter is, for the most part, just like a total horror show empirically. And I think, if you look at the Foster and Hagen review piece, which folks have referred to a bunch of times, I mean, there are things in there that provide plausibly causal estimates based on pretty broadly representative data, both in sort of the Danish context where, Lasse and Sina have been doing a bunch of good stuff, but also within the US context. And so I actually think we should push harder, and I think there are more things we could do, but it would be hard for me to think of an area that has made more progress in the last 15 years in terms of thinking about the effects and also the context. But I could be totally wrong. And I'm on board with like everything else you said, so I feel like hopefully we're still good.
We'll always be good, you know that. So what I would say again, so my standpoint, right? This is not my literature or literatures. And what I was tasked with doing was to read a set of papers that are largely reviews of the literature. If you just read the reviews of the literature, right, there's so much that you identified that isn't necessarily unpacked in the reviews. So we're both correct, I would say. Although you're more correct than I because you have a better vantage point on these sorts of things. So.
Yeah. But I think that's one thing that's one thing in the volume that we should really drive home, I think. Because I think, especially in this literature, as more and more and more folks have gotten invested who have worked in other areas before, they can really see a lot of the problems and a lot of the gaps. But I do think we should do more to talk about the accomplishments that have been made in this area, I think, in some ways. And so that's something we appreciate that. Awesome.
I just wanted to throw out something, particularly when I was listening to the talk on community-based participatory research, is some of the barriers to research in this area that I know all of us have encountered and it has been mentioned about working in correction settings, going through human subjects in those settings, as well as our university, and the challenges that are really quite remarkable, particularly depending on what state you're in terms of accessing data. So that is part, I would agree with Chris in terms of the growth of this literature. And I think the more methods we have in our toolkit, the better. One of the challenges with CBPR is when you have, it's a human subjects challenge, is when you have participants also interpreting the data, particularly in a close-knit community, there's privacy issues that often are flagged by human subjects review boards. So that was my one issue, is that we're continually grappling. I think we are really pretty savvy. I know I'm very savvy in terms of how to deal with human subjects, how to ethically get around them and still take care of my participants, because there's always these, oh no, you can't do that. So, then it's like, okay. So I think we're also very adaptable as researchers in trying to respond to not only the institutional barriers of dealing with corrections, and doing that kind of research, and also studying children. So there's that. Prisoners are vulnerable classes of participants, so there's really very, very thick protections that I think can also serve to perpetuate their invisibility. But I also think, and I was talking to Kristen about this last night, and I've done some writing about this, there's also some of the emotional toll in doing this research as researchers, as we go into these settings and work with folks and hear their stories. and finding ways to take care of ourselves as researchers as well. So I would also say that the field has progressed just remarkably in terms of the amount of research. No, it's not all causally perfect and nationally representative and all that stuff, but people are writing about it, they're thinking about it, they're figuring it out, and they're doing this in the context of a lot of human subjects and institutional barriers to doing that work.
Yeah, after reflecting, on the day's sessions yesterday and the conversations today, I was thinking about an untapped resource that we haven't really spoken to, especially in terms of community-based support and programs, are the schools and the early care and education programs, because our children are, in those systems of care for a very long period of the day. And, young children who are with early care and education providers, that caregiver plays such a critical role in really, organizing their day and being such a source of kind of helping to buffer the effects of incarceration and that whole cycle. So, and the schools, the teachers, just to have awareness of what's going on in that child's life. So if there's a problem with homework, somehow, the grades start to change, they have more context in terms of what might be going on in that child's life and how they can maybe connect to family members, parents, or caregivers in that child's life and start having a conversation around that. Or maybe there are support groups that can be developed if there's multiple children in the school or in surrounding schools that have incarcerated parents. So just something to keep in mind.
I guess I wanted to, it's been an amazing 2 days, so I'm just so grateful that I was able to be in the room as one of the few kind of community-based policy advocacy organizations. So I guess I was left thinking, how can your research, future, and design help us be more Danish? And so that how can, if you're designing or looking at ATIs, can you design it so that people with violent charges are not excluded? So that it's different kinds of categories that we look at so that the research helps not perpetuate, but push the United States out of the boxes that we're in. So instead of continuing the violent, nonviolent, or as Sarah really pushed us around that, and what Michael said about decarceration, for the legislation you talked about, could the research show that, instead of building prison nurseries, which there is evaluation showing that there are many benefits, can we have these babies and moms outside of the criminal justice system? So just hopeful. And I think to speak to how that we have come a long way in showing just the huge damaging ripple effects of mass incarceration on children and families. And I use Chris and Sarah's book all the time, Children of the Prison Boom, because it helps us bring the Department of Homeless Services to our meeting and bring the Department of Health there, because who knew that mass incarceration is affecting homelessness and infant mortality? So again, just to echo what Maddie said, from our standpoint, all of your research is incredibly important. Thank you.
Hi, I just have a quick comment. I was thinking about one more thing that makes me uncomfortable that I didn't talk about here. But I wonder too about how you get departments of corrections on board, and I know all of us have I have good relationships with some and really difficult ones with others, and so we're stuck in where we can study. I do think it's also important to think about what's going on in corrections, and so one thing that I find sort of horrifying is the embracing of risk assessment. I think it builds in poverty and race in really troubling ways, and I don't love the degree to which it's used, but it has been embraced, and I sometimes think we can leverage, instead of just saying, oh, those assessment scores are awful, we can kind of creatively use them to leverage our goals. And so one, you know, the risk assessment literature basically shows that if you don't recidivate within 5 years, your level of risk returns to someone who's never been incarcerated. And I think we sort of have to meet people where they're at, and if that's what's happening among corrections officials and practitioners, that it doesn't help to just sort of say, oh, those instruments are, and I think they're terrible too, right? But I do think being in conversation with people working in prisons and is much more useful than sort of denigrating what they're doing. So I think that's another one that I really struggle with. So.
I'm not really one of you. I'm not a researcher. My name is Connie Ferris Myer. I graduated from College of Human Ecology in 1970, and I studied what was then called Child Development and Family Studies, and of course now it's Human Development and Family Studies. Urie Bronfenbrenner was one of the very first professors I had here, and was pretty much my very favorite, always. Wonderful person. And I wanted to tell you why I'm here. The topic really struck me because of a couple of situations that I find myself in my life right now. One, I have a cousin in New York State who has been incarcerated, and of course his children are my younger cousins, and so you know, that really rings a very close bell for me. He's the same age as my daughters. He's a wonderful person, funny, but he really messed up, and it's taking him a long time to get totally out of the system. So that's one thing. But then my mom, class of 47, is 90 and lives in Maryland, on the eastern shore of Maryland, and she's in a retirement community, but is in the medical wing. 2 years ago, I talked to her about it, but really I established an LLC called Connie's Companions. She is also Connie. We're the Connies. And so we employ between 8 and 10 women who are companions and sitters for her around the clock. And I have absorbed all of their personal situations. Just seems to be something I do. And it's overwhelming at times. Some of the women are my age and older. But there are 2 young women who are single moms, for the most part, the breadwinners of their family. The young woman I'm most concerned about, and when Tiffany was talking, it was like, ding, and also Maddie, I thought, this is what needs to happen. She is 26, has 5 children by 2 different fathers. One father is now in prison for about 10 years. The other one has been in and out. I only know of him. I have not met him. I do not want to meet him. But I was thinking today, when I'm not sure which one of you said, well, it was the corrections, I believe. He has 8 children. 3 of them were with this young woman that works for me. He beats women. He contributes nothing to their financial situations. And he just seems like a really mean, awful person. And that's not nice to say because I don't know him. But then in addition to that, his whole family is like this. They harass my employee. They threaten her. They are absolutely no support to the 3 children that she has. And so it just goes on. I mean, I could just go on and on and on about this. And with all this being said, I realize because of my child psychology background, I believe that I kind of understand why he does what he does. His mother had 7 children by many different men. He never really had a family and didn't really know what love was and being taken care of. And so, instead of going in the direction of doing better, he's basically done what he knows. So and then I think about this community. She lives in a subsidized housing community. It's pretty rural. It's dark at night. It's scary. And that's the place where I was saying it's not really a community. Nobody really seems to care about the person next door. If he comes and violates the prohibition of him being near her, nobody's going to call the police because there's a lot of drug dealing, and they're afraid they're going to get in trouble. And they'll even turn each other in. So there's not a community. I'm thinking that's what needs to happen in this it's Kent County, Maryland. There needs to be an intervention, or establish some sort of caring in this community. I'm not exactly sure how to do it, but that was the thing that hit me today, that maybe that's where it has to start, because it's just such a mess, and it's just so many layers of, and this young man has been in and out of prison. He got out about 10 days ago. 2 days later, he was videotaped beating some people up and went back into jail, had a $75,000 bail put on him, and somebody got him out within about half a day. I didn't know you can put the bail money on a credit card. Did you all know that? The 10%, it's either cash or you can put it on a credit card. So apparently that's what somebody did. So it's just, to me, it's mind-boggling, the whole situation. And it's not, I can't really imagine deep down that he wants to be like this. But there's no way, I don't think he feels like there's any way out for him. And there really isn't a community. It's like nobody likes this area. And the young woman has no family support at all. And, it's just, I came here thinking, okay, you all are going to tell me I'm going to fix this, what I can do for her, what I can do for the children. And I tried some things, but not the underlying thing is just so complicated. So I appreciate all of your research and all the things I learned from you today. And if you have any ideas, my email's on the list. But it's not funny. It's terribly sad, and it just overwhelms me and makes my heart ache. And I'm just talking about 5 kids. So I'm seeing this little tiny microcosm of a horrible problem that's got to be multiplied. I can't even imagine how many people are in this situation in this country. And so maybe, and I wanted to say a couple of other things. I thought you were brilliant, Tiffany, for the final. You said you were planning to come and do a brilliant speech at the very end. Okay, she said that, didn't she? And Maddie, you're good. And I'm so pleased to hear that you're working with the White House, and I sincerely hope that will continue after November or January, okay? And it's interesting to me that I'm obsessed by the election. And there's been so much discussion of childcare and various other issues. I don't think I've heard anything about incarceration, about the prison system, about the corrections. Interesting, because obviously it's a big deal, and it has an impact on everything else. And I'm sure you all know that Urie Bronfenbrenner was one of the leading people in starting Head Start. And yet there's still people that think we shouldn't have Head Start. And that always seems to me that it goes right, well, if you don't do Head Start, the correction system is going to be more and more full. And so there are a lot of connections that I don't think, they're talking about a lot of issues, but it seems like correction ought to be one of them that is not being discussed at all. And this came to me also. Has anybody ever thought about talking to Bill and Melissa Gates about funding for any of this? Because I know they do a lot around the world. And I'm sure they do quite a bit. I know they helped build a fairly recent building on campus. But does anybody look into resources like that? Pardon? And international. I wonder, maybe somebody should let them know what's going on here, and they could, focus some of this. Or is it Mr. Zuckerberg? He and his wife are going to be giving, most of their estate away, and so that was just a thought. I'm not a grant writer, but because they seem to be people that really care about other people, and maybe this is an area they could think about helping with. Thank you all very much for being here.
All right, I don't know how to work this. Oh yes, it's working now. Great. So it's 12:30, and we're really come to the end of our conference. And so I don't know if Julie has any sort of closing remarks, or if Chris has any sort of closing remarks. He says no. But I wanted to say, I thought I have really enjoyed bringing, as a part of the group, bringing us all together for this last day and a half. It has been amazing, and I have appreciated all of the presenters, and especially I loved the commentaries today. I thought you all presented a really unique and interesting and important perspective that together really tied this really nicely together and sort of can send us on our way in thinking moving forward with the research that we can do and how to disseminate it and how to address issues where I think Tiffany's comment about how we're all sort of touching a different part of the elephant. I appreciate that I can be a wise woman in this, but I think even part of that, like moving forward and thinking about how to do that. So I'm going to pass this to Julie if she wants to say a few words before we go to lunch.
Great. Thank you so much, everyone, for being here. We have been planning this for quite some time now, and we're thrilled that it went pretty well, and that you each gave your input, whether it was in the form of presentations, commentary, questions, discussion. And one of the things we truly hope that comes out of this, in addition to the book that will come out of it, is more collaboration. I mean, everybody here is so important in this endeavor. We really need scholars working with community partners and the government and corrections and policy people, and we all, I think, will benefit, and we can recognize that we have common goals. Despite all of our differences in whatever we do, our common goal is to make the lives of children and families and individuals better, however you define that. But I do think that the better will come from more working together. And I would just challenge everyone to just take a moment right now, while we're still in this space together, to think about what are maybe 2 things that you could do differently or with somebody else, either in this room or in whatever community you're in, to try to address the issues that have been raised here. Because even though we really have come a long way in the time since Joyce and I have been working on these issues to now, there's still so far to go. And I know sometimes we've thought, oh my gosh, this is so depressing, and knowing what we know. But we each can really do something to help. And now I think is finally people are sitting up and taking note of this issue, which has been part of the challenge in this area, as so many people have even noticed. And now is a good time, I think, to make a difference. And I know we really all want to do that. So my heartfelt thanks to everybody. Thank you.